Question 1. A nurse is caring for a client with a new prescription for warfarin. Which statements indicate that the client understands the teaching regarding this medication? Select all that apply. A. I should avoid eating green leafy vegetables while taking this medication. B. I will need to have my blood checked regularly to monitor this medication's effects. C. I should report any unusual bleeding or bruising to my doctor. D. I can take aspirin for headaches if needed. E. I will use an electric razor for shaving instead of a straight razor. F. I need to take this medication at the same time every day. Answer. I will need to have my blood checked regularly to monitor this medication's effects. I should report any unusual bleeding or bruising to my doctor. I will use an electric razor for shaving instead of a straight razor. I need to take this medication at the same time every day. This question tests understanding of essential client education for warfarin, an anticoagulant. The keyword warfarin indicates a need for bleeding precautions and consistent monitoring. Regular blood tests, INR/PT, are crucial to ensure the medication's therapeutic effect, and reporting unusual bleeding or bruising is vital as these are signs of excessive anticoagulation. Using an electric razor reduces the risk of cuts and bleeding, and taking the medication at the same time daily maintains stable blood levels. For example, a client who understands to use a soft toothbrush and avoid falls demonstrates good adherence to safety measures. Here's an easy way to remember it. Think bleeding precautions, lab monitoring, education on food/drug interactions, exact dosing, and document/report issues. Question 2. A nurse is assessing a client admitted with fluid volume overload. Which findings should the nurse expect? Select all that apply. A. Hypotension. B. Bounding pulse. C. Distended neck veins. D. Peripheral edema. E. Decreased urine output. F. Dry mucous membranes. Answer. Bounding pulse, distended neck veins, peripheral edema. This question assesses the nurse's knowledge of the clinical manifestations of fluid volume overload. The phrase fluid volume overload is the key indicator for excess fluid in the body. A bounding pulse, distended neck veins, jugular venous distension, and peripheral edema are all classic signs of too much fluid circulating and accumulating in tissues. Hypotension, decreased urine output, and dry mucous membranes are typically associated with fluid volume deficit. For example, a client with congestive heart failure often presents with these same signs due to the heart's inability to effectively pump fluid. Here's an easy way to remember it. Think too much fluid, too much pressure, leading to visible swelling and increased pulse strength. Question 3. A nurse is caring for a client immediately after a thyroidectomy. Which actions should the nurse include in the plan of care? Select all that apply. A. Encourage coughing and deep breathing exercises every hour. B. Keep a tracheostomy tray at the bedside. C. Assess for signs of hypocalcemia, such as tingling around the mouth. D. Place the client in a high Fowler's position. E. Monitor for signs of hemorrhage, such as frequent swallowing. F. Administer pain medication as prescribed. Answer. Keep a tracheostomy tray at the bedside. Assess for signs of hypocalcemia, such as tingling around the mouth. Monitor for signs of hemorrhage, such as frequent swallowing. Administer pain medication as prescribed. This question tests critical postoperative nursing care for a thyroidectomy client. The phrase immediately after a thyroidectomy highlights the need for vigilance regarding airway and specific complications. Keeping a tracheostomy tray available is vital for potential airway obstruction, and assessing for hypocalcemia, e.g., tingling, is crucial due to possible parathyroid gland damage. Monitoring for hemorrhage, often indicated by frequent swallowing as blood accumulates, is also paramount, and providing pain medication as prescribed promotes comfort and healing. For example, ensuring the client's neck is supported when moving can prevent strain on the incision. Here's an easy way to remember it: prioritize airway, bleeding, calcium, and comfort. Question 4. A nurse is teaching a client about measures to prevent a urinary tract infection, UTI. Which instructions should the nurse include? Select all that apply. A. Wipe from back to front after using the toilet. B. Drink at least 8 glasses of water daily. C. Take a bubble bath daily to cleanse the perineal area. D. Urinate after sexual intercourse. E. Wear cotton underwear. F. Limit cranberry juice intake. Answer. Drink at least 8 glasses of water daily, urinate after sexual intercourse, wear cotton underwear. This question assesses knowledge of health promotion strategies to prevent urinary tract infections. The focus is on preventing a urinary tract infection. Drinking plenty of water helps flush bacteria from the urinary system. Urinating after sexual intercourse helps expel bacteria introduced during activity, and wearing cotton underwear promotes ventilation, reducing moisture that fosters bacterial growth. Wiping from front to back, not back to front, prevents introducing fecal bacteria into the urethra, and limiting bubble baths is advisable as they can irritate the urethra. For example, a client who consistently drinks water throughout the day is actively reducing their risk. Here's an easy way to remember it: think flush, empty, breath, flush bacteria, empty bladder, let skin breathe. Question 5. A nurse is caring for a client with a gastrostomy tube, G-tube, who is receiving continuous enteral feedings. Which actions should the nurse include in the plan of care? Select all that apply. A. Change the feeding bag and tubing every 24 hours. B. Flush the G-tube with 15 milliliters of water every 8 hours. C. Keep the head of the bed elevated to at least 30 degrees. D. Monitor gastric residual volumes every 4 to 6 hours. E. Administer medications through the feeding tube without flushing. F. Provide frequent oral care. Answer. Change the feeding bag and tubing every 24 hours, keep the head of the bed elevated to at least 30 degrees, monitor gastric residual volumes every 4 to 6 hours, provide frequent oral care. This question covers essential nursing care for a client with a G-tube receiving continuous enteral feedings. The key phrase, continuous enteral feedings, indicates the need for specific safety and comfort measures. Changing the feeding bag and tubing every 24 hours reduces the risk of bacterial contamination, and elevating the head of the bed prevents aspiration. Monitoring gastric residual volumes helps assess tolerance to feedings and prevent overfeeding, and frequent oral care is vital because clients receiving enteral feedings do not eat orally and are at risk for oral dryness and infection. Flushing the G-tube with a greater volume, e.g., 30 milliliters, and before and after medications is typically recommended, and medications should always be flushed both before and after administration. Here's an easy way to remember it: think aspiration risk, and remember the key interventions to prevent it, plus hygiene. Question 6. A nurse is educating a client newly diagnosed with type 1 diabetes mellitus about insulin administration. Which statements indicate an understanding of the teaching? Select all that apply. A. I will rotate injection sites to prevent tissue damage. B. I can store my opened insulin vial at room temperature for up to 28 days. C. I should inject my insulin into the same exact spot each time for best absorption. D. I will draw up my regular insulin first, then my NPH insulin. E. I need to gently roll cloudy insulin vials before drawing up the dose. F. I will dispose of my used needles in a plastic grocery bag. Answer. I will rotate injection sites to prevent tissue damage. I can store my opened insulin vial at room temperature for up to 28 days. I will draw up my regular insulin first, then my NPH insulin. I need to gently roll cloudy insulin vials before drawing up the dose. This question assesses the client's understanding of safe and effective insulin administration. The focus is on insulin administration for a new diabetic. Rotating injection sites is crucial to prevent lipohypertrophy, which can impair absorption. Opened insulin vials can be kept at room temperature for up to 28 days to improve comfort with injections. When mixing insulin, clear, regular, insulin should always be drawn up before cloudy, NPH, insulin to prevent contaminating the regular insulin vial. Cloudy insulins, like NPH, require gentle rolling to mix the suspension before administration. For example, using the abdomen, thighs, and upper arms in a rotating pattern is a good practice. Here's an easy way to remember it. Think RRCC, rotate, room temperature, regular first, cloudy rolled. Question 7. A nurse is preparing to administer medications through a nasogastric, NG, tube. Which actions should the nurse take? Select all that apply. A. Crush all medications into a fine powder before administering. B. Aspirate gastric contents to check for residual volume. C. Flush the tube with 15 milliliters of water before and after each medication. D. Position the client in a high Fowler's position. E. Mix all medications together in one syringe for efficiency. F. Disconnect suction for 30 to 60 minutes after medication administration. Answer. Aspirate gastric contents to check for residual volume. Flush the tube with 15 milliliters of water before and after each medication. Position the client in a high Fowler's position. Disconnect suction for 30 to 60 minutes after medication administration. This question tests the safe practice of administering medications via an NG tube. The key phrase is administer medications through a nasogastric, NG, tube. Aspirating gastric contents assesses tube placement and residual volume, and flushing before and after each medication prevents clogging and ensures delivery. Positioning the client in high Fowler's helps prevent aspiration. If the NG tube is connected to suction, it should be clamped or disconnected for 30 to 60 minutes after medication administration to allow absorption. Not all medications can be crushed. Some are extended release or enteric-coated and should never be crushed, and mixing all medications together is poor practice as it can lead to interactions or clogging. Here's an easy way to remember it. Always think safety first. For NG tube medications, focusing on placement, patency, and prevention of aspiration. Question 8. A nurse is providing discharge teaching to a client with heart failure. Which instructions should the nurse include? Select all that apply. A. Limit your daily fluid intake to 2 liters. B. Weigh yourself daily and report a weight gain of more than 2 to 3 pounds in a day. C. Continue to eat a high-sodium diet to maintain electrolyte balance. D. Report any increased shortness of breath or swelling in your ankles. E. Elevate your legs when sitting to reduce edema. F. Avoid all physical activity to prevent worsening symptoms. Answer. Limit your daily fluid intake to 2 liters. Weigh yourself daily and report a weight gain of more than 2 to 3 pounds in a day. Report any increased shortness of breath or swelling in your ankles. Elevate your legs when sitting to reduce edema. This question assesses essential discharge teaching for a client with heart failure. the focus is on self-management for heart failure. Limiting fluid intake helps prevent fluid volume overload, and daily weight monitoring is critical to detect fluid retention early. Reporting symptoms like increased shortness of breath or ankle swelling is vital, as these indicate worsening heart failure, and elevating legs helps reduce dependent edema. A low-sodium diet is crucial, not a high-sodium one, and regular, appropriate physical activity is often encouraged. For example, teaching a client to notice when their shoes feel tighter indicates fluid retention. Here's an easy way to remember it. Think daily self-care, daily weights, activity modification, intake limits, look for symptoms, elevate limbs. Question 9. A nurse is assessing a client for signs of impending death. Which findings should the nurse expect? Select all that apply. A. Increased interest in food and drink. B. Mottling of the extremities. C. Increased urinary output. D. Cheyne-Stokes respirations. E. Weak, thready pulse. E. Periods of apnea. Answer. Mottling of the extremities, Cheyne-Stokes respirations, weak, thready pulse, periods of apnea. This question tests the nurse's ability to recognize physical signs indicating the dying process. The phrase signs of impending death directs attention to physiological changes as the body begins to shut down. Mottling of the extremities, a purplish, blotchy appearance, occurs due to poor circulation. Cheyne-Stokes respirations are a pattern of waxing and waning breathing with periods of apnea, and a weak, thready pulse reflects decreased cardiac output. Periods of apnea, where breathing temporarily stops, are also common. Decreased interest in food and drink, along with decreased urinary output, are more typical. For example, a client may exhibit shallow, rapid breathing followed by long pauses. Here's an easy way to remember it. Think body shutting down, circulation slows, breathing patterns change erratically, and energy declines significantly. Question 10. A nurse is caring for a client who is receiving total parenteral nutrition, TPN. Which actions should the nurse include in the plan of care? Select all that apply. A. Change the TPN tubing every 72 hours. B. Monitor blood glucose levels every 6 hours. C. Administer TPN through a peripheral 4-line. D. Weigh the client daily. E. Use an infusion pump for administration. E. Hang a new bag of TPN every 12 hours. Answer. Monitor blood glucose levels every 6 hours, weigh the client daily, use an infusion pump for administration. This question assesses essential nursing care for clients receiving total parenteral nutrition, TPN. The keyword TPN indicates the need for careful monitoring and administration due to its high glucose content and intravenous delivery. Monitoring blood glucose levels every 6 hours is crucial to detect hyperglycemia. Daily weights assess fluid balance and nutritional status, and an infusion pump ensures accurate and controlled delivery, preventing fluid overload or rapid glucose fluctuations. TPN tubing should typically be changed every 24 hours with the new bag, not 72 hours. TPN is usually administered via a central venous line, and a new bag is typically hung every 24 hours, not 12 hours, unless lipids are infused separately for a shorter duration. For example, maintaining strict aseptic technique during dressing changes for the central line is also vital. Here's an easy way to remember it. Think high sugar, high risk, monitor glucose, check weight, use pump, and strict asepsis for the central line. Question 11. A nurse is providing education to a client prescribed a new medication that is a controlled substance. Which information should the nurse include? Select all that apply. A. You can share this medication with family members if they have similar symptoms. B. Store the medication in a secure, locked location. C. Report any leftover medication to the pharmacy for disposal instructions. D. Do not crush or chew extended-release formulations. E. Be aware of potential side effects like drowsiness or dizziness. F. It's acceptable to take an extra dose if your pain is severe. Answer. Store the medication in a secure, locked location. Report any leftover medication to the pharmacy for disposal instructions. Do not crush or chew extended-release formulations. Be aware of potential side effects like drowsiness or dizziness. This question tests the nurse's understanding of safe medication practices, especially for controlled substances. The keywords controlled substance highlight the need for strict handling, storage, and patient education. Storing the medication securely prevents misuse and theft, and reporting leftover medication to the pharmacy ensures proper disposal, preventing diversion. Extended-release formulations should not be crushed or chewed, as this can lead to rapid absorption and overdose, and clients must be aware of potential side effects like drowsiness or dizziness due to safety concerns. Sharing medications is illegal and dangerous, and taking extra doses can lead to overdose. For example, educating a client to keep their oxycodone in a locked cabinet away from children is an important safety measure. Here's an easy way to remember it. Think SAFE, secure storage, avoid sharing, follow instructions, effects to watch for. Question 12. A nurse is assessing a client with a new colostomy. Which findings indicate a healthy stoma? Select all that apply. A. Dark blue or purple stoma color. B. Moist and shiny appearance. C. Pink or beefy red color. D. Peristomal skin excoriation. E. Mild swelling initially post-op. F. Stoma is dry and pale. Answer. Moist and shiny appearance, pink or beefy red color, mild swelling initially post-op. This question assesses the nurse's ability to identify characteristics of a healthy stoma. The term healthy stoma is the key indicator for normal findings. A moist and shiny appearance and a pink or beefy red color both indicate adequate blood supply and tissue viability. Mild swelling immediately after surgery is also considered a normal finding due to tissue trauma. A dark blue, purple, dry, or pale stoma suggests ischemia or poor circulation, while peristomal skin excoriation indicates irritation and damage to the surrounding skin, which are unhealthy signs. For example, teaching a client that their stoma should look similar to the inside of their mouth can help them identify normal characteristics. Here's an easy way to remember it. Think M-R-S, moist, red, swollen, initially. Question 13. A nurse is planning care for a client at risk for falls. Which interventions should the nurse include? Select all that apply. A. Keep the bed in the lowest position. B. Ensure adequate lighting in the client's room. C. Place frequently used items within the client's reach. D. Restrain the client if they attempt to get out of bed unassisted. E. Encourage the client to wear non-skid footwear. F. Conduct hourly rounding to address client needs. Answer. Keep the bed in the lowest position. Ensure adequate lighting in the client's room. Place frequently used items within the client's reach. Encourage the client to wear non-skid footwear. Conduct hourly rounding to address client needs. This question tests the nurse's knowledge of fall prevention strategies. The phrase "at risk for falls" indicates the need for multiple safety interventions. Keeping the bed in the lowest position reduces the distance if a fall occurs. Adequate lighting improves visibility. and placing items within reach minimizes the need for the client to stretch or get out of bed unsafely. Non-skid footwear provides better traction, and hourly rounding proactively addresses client needs like toileting or pain, reducing their need to get up independently. Restraints should only be used as a last resort and with a physician's order, not as a primary fall prevention method. For example, ensuring a call light is always nearby allows a client to request help before attempting to stand alone. Here's an easy way to remember it: think safe environment, remove hazards, provide support, and anticipate needs. Question 14. A nurse is preparing to administer a blood transfusion. Which actions should the nurse take? Select all that apply. A. Obtain baseline vital signs before starting the transfusion. B. Use a 22-gauge peripheral forecatheter for administration. C. Verify the client's identity and blood product with another licensed nurse. D. Infuse the blood product over 6 hours to prevent reactions. E. Prime the foretubing with 0.9% normal saline solution. F. Administer pre-medications, e.g., antihistamine, routinely to all clients. Answer. Obtain baseline vital signs before starting the transfusion. Verify the client's identity and blood product with another licensed nurse. Prime the foretubing with 0.9% normal saline solution. This question assesses critical safety steps for blood product administration. The phrase "administer a blood transfusion" highlights the need for meticulous verification and monitoring. Obtaining baseline vital signs is essential for comparison if a reaction occurs, and strict two-person verification of the client's identity and blood product ensures the correct blood is given to the correct client. Priming the foretubing with 0.9% normal saline is necessary because it is the only solution compatible with blood products. A 22-gauge catheter may be too small and cause hemolysis. A larger gauge, e.g., 18 or 20, is preferred. Blood should typically be infused within 4 hours, not 6, and pre-medications are given only if ordered, not routinely. For example, double-checking the client's armband against the blood bag label with a colleague is a crucial safety step. Here's an easy way to remember it: think vital check, verify, identify, type, administer with saline, look for reactions, check vitals. Question 15. A nurse is caring for a client with Clostridium difficile, C. difficile, infection. Which infection control measures should the nurse implement? Select all that apply. A. Wear an N95 respirator mask when entering the client's room. B. Use an alcohol-based hand sanitizer before and after client care. C. Wear gloves when providing direct client care. D. Place the client in a private room. E. Use soap and water for hand hygiene. F. Wear a gown when entering the client's room. Answer. Wear gloves when providing direct client care. Place the client in a private room. Use soap and water for hand hygiene. Wear a gown when entering the client's room. This question focuses on appropriate infection control for Clostridium difficile, C. difficile. The key phrase Clostridium difficile, C. difficile, infection specifically requires contact precautions and spore-killing hand hygiene. Wearing gloves and a gown when entering the room are essential components of contact precautions. Placing the client in a private room helps contain the infection, and using soap and water for hand hygiene is critical because alcohol-based sanitizers are ineffective against C. diff spores. An N95 mask is for airborne precautions, not C. diff. For example, ensuring visitors also wear appropriate PPE before entering the room reinforces infection control. Here's an easy way to remember it: think GGPS, gloves, gown, private room, soap and water. Question 16. A nurse is assessing a client experiencing a severe allergic reaction, anaphylaxis. Which findings should the nurse expect? Select all that apply. A. Bradycardia. B. Hypotension. C. Bronchospasm. D. Urticaria. E. Angioedema. F. Hypertension. Answer: hypotension, bronchospasm, urticaria, angioedema. This question assesses the nurse's ability to recognize the signs of a severe allergic reaction. The keyword anaphylaxis indicates a life-threatening systemic response. Hypotension, low blood pressure, is common due to vasodilation. Bronchospasm leads to respiratory distress and wheezing. Urticaria, hives, is a widespread itchy rash, and angioedema, swelling, especially of the face, lips, and airway, can compromise the airway. Tachycardia, not bradycardia, is typically seen as the body tries to compensate for low blood pressure, and hypertension is not a typical sign. For example, a client developing sudden facial swelling, hives, and difficulty breathing after an antibiotic injection is experiencing anaphylaxis. Here's an easy way to remember it. Think A, B, C, S, airway, breathing, circulation, skin. Question 17. A nurse is caring for a client who is NPO and scheduled for surgery. Which actions are appropriate for the nurse to perform? Select all that apply. A. Offer the client ice chips for comfort. B. Administer oral medications with a small sip of water. C. Remove the water pitcher from the bedside table. D. Explain the importance of being NPO to the client. E. Perform frequent oral hygiene. F. Document the client's NPO status. Answer: remove the water pitcher from the bedside table, explain the importance of being NPO to the client, perform frequent oral hygiene, document the client's NPO status. This question tests the nurse's understanding of NPO status and related care. The key phrase NPO and scheduled for surgery indicates the necessity of preventing oral intake to minimize aspiration risk during anesthesia. Removing the water pitcher eliminates temptation, explaining NPO status helps ensure client compliance, and performing frequent oral hygiene helps alleviate dry mouth discomfort without actual intake. Documenting NPO status is crucial for communication among the healthcare team. Offering ice chips or administering oral medications with water violates NPO status. For example, offering a client a wet sponge to moisten their lips helps comfort them while maintaining NPO. Here's an easy way to remember it. Think NO oral intake equals NO aspiration and focus on patient safety and comfort within that rule. Question 18. A nurse is providing education to a client prescribed a new diuretic medication. Which instructions should the nurse include? Select all that apply. A. Take the medication at bedtime to promote sleep. B. Increase your intake of potassium-rich foods. C. Monitor your weight daily and report significant changes. D. Change positions slowly to prevent dizziness. E. Expect to urinate more frequently. F. Limit your fluid intake to prevent dehydration. Answer: monitor your weight daily and report significant changes. Change positions slowly to prevent dizziness. Expect to urinate more frequently. This question assesses client education regarding diuretic medications. The keyword diuretic indicates medication that increases urine output and affects fluid balance. Clients should monitor their weight daily for sudden changes, which can indicate fluid retention or excessive fluid loss. Changing positions slowly helps prevent orthostatic hypotension, a common side effect causing dizziness, and clients should expect increased urinary frequency due to the medication's action. Taking diuretics at bedtime can disrupt sleep with frequent urination. Increasing potassium-rich foods is only necessary for potassium-wasting diuretics, not all, and fluid intake should be maintained unless otherwise specified, not necessarily limited. For example, teaching a client to sit on the edge of the bed for a moment before standing can prevent falls. Here's an easy way to remember it. Think fluid loss precautions, watch for weight changes, take care with movement, and expect to pee more. Question 19. A nurse is assessing a client with a suspected deep vein thrombosis, DVT. Which findings should the nurse expect? Select all that apply. A. Warmth and redness over the affected extremity. B. Pallor and coolness of the affected extremity. C. Unilateral leg swelling. D. Diminished or absent peripheral pulses. E. Positive Holman's sign. F. Pain or tenderness in the calf. Answer. Warmth and redness over the affected extremity, unilateral leg swelling, pain or tenderness in the calf. This question tests the nurse's ability to identify clinical manifestations of a deep vein thrombosis. The term deep vein thrombosis, DVT, points to inflammation and obstruction of a deep vein. Warmth and redness, unilateral leg swelling, and pain or tenderness in the calf are classic signs resulting from venous congestion and inflammation. Pallor, coolness, and diminished pulses are more indicative of arterial compromise. While a positive Holman's sign, calf pain with dorsiflexion, was historically associated with DVT, it is no longer considered a reliable diagnostic indicator due to its low sensitivity and specificity, and potential to dislodge a clot. For example, a client might describe their calf as feeling tight and painful, especially when walking. Here's an easy way to remember it. Think C-L-O-T, calf pain, leg swelling, unilateral, overlying warmth, tenderness. Question 20. A nurse is caring for a client with a history of seizures. Which interventions should the nurse include in the client's plan of care to ensure safety? Select all that apply. A. Ensure padded side rails are in place. B. Place the client in a supine position during a seizure. C. Have suction equipment readily available. D. Restrain the client's extremities during a seizure. E. Remove restrictive clothing and objects from around the neck. F. Document the duration and characteristics of any seizure activity. Answer. Ensure padded side rails are in place, have suction equipment readily available, remove restrictive clothing and objects from around the neck, document the duration and characteristics of any seizure activity. This question assesses appropriate nursing interventions for seizure precautions. The key phrase history of seizures and ensure safety mandates proactive measures. Padded side rails help prevent injury from involuntary movements. Having suction equipment readily available is important for managing airway secretions, and removing restrictive clothing helps ensure a clear airway. Documenting seizure characteristics and duration is crucial for diagnosis and treatment effectiveness. Placing the client in a side-lying position is preferred during a seizure to prevent aspiration, and restraining extremities should be avoided as it can cause injury. For example, ensuring the call light is always within reach so the client can alert staff if they feel an aura is also a good safety measure. Here's an easy way to remember it. Think P-R-E-P, padded, ready suction, ease clothing, protect from injury, no restraints. Question 21. A nurse is caring for a client with an indwelling urinary catheter. Which actions should the nurse take to prevent catheter-associated urinary tract infections, CAUTIs? Select all that apply. A. Perform perineal care with soap and water daily. B. Ensure the drainage bag is kept above the level of the bladder. C. Empty the drainage bag when it is full. D. Secure the catheter tubing to the client's thigh. E. Use sterile technique when inserting the catheter. F. Irrigate the catheter routinely with antibiotic solution. Answer. Perform perineal care with soap and water daily. Secure the catheter tubing to the client's thigh. Use sterile technique when inserting the catheter. This question addresses interventions to prevent catheter-associated urinary tract infections, CAUTIs. The keywords indwelling urinary catheter and prevent CAUTIs focus on infection control. Performing perineal care daily helps reduce bacterial entry. Securing the catheter prevents tension and movement that can cause irritation and introduce bacteria, and using sterile technique during insertion is paramount to maintaining sterility. The drainage bag must always be kept below the level of the bladder to prevent reflux of urine, and it should be emptied before it becomes completely full, typically when half to two-thirds full, to prevent backflow and maintain drainage. Routine irrigation with antibiotics is not recommended due to resistance and disruption of normal flora. For example, consistently reminding staff about proper hand hygiene before any catheter interaction is also essential. Here's an easy way to remember it. Think SAFE. Cath, sterile insertion, always below bladder, flush daily, pericare, empty regularly, secure. Question 22. A nurse is performing wound care for a client with a stage 3 pressure ulcer. Which actions should the nurse include? Select all that apply. A. Use clean gloves for initial wound assessment. B. Irrigate the wound with hydrogen peroxide. C. Assess the wound for signs of infection, such as purulent drainage. D. Apply a sterile dressing using sterile technique. E. Document the wound size, depth, and appearance. F. Position the client to relieve pressure on the wound. Answer. Assess the wound for signs of infection, such as purulent drainage. Apply a sterile dressing using sterile technique. Document the wound size, depth, and appearance. Position the client to relieve pressure on the wound. This question tests appropriate nursing care for a pressure ulcer. The keyword stage 3 pressure ulcer indicates a deep wound requiring meticulous care. Assessing for signs of infection is critical to identify complications. Applying a sterile dressing with sterile technique minimizes contamination, and documenting wound characteristics provides a baseline for evaluating healing. Positioning the client to relieve pressure is fundamental for wound healing. While clean gloves can be used for initial removal of old dressings, sterile gloves are preferred for direct wound care and applying new dressings. Hydrogen peroxide is cytotoxic and generally not recommended for routine wound irrigation as it can damage healthy tissue. For example, turning and repositioning the client every 2 hours helps prevent further breakdown. Here's an easy way to remember it. Think A, D, P, A, assess, document, position, apply sterile dressing. Question 23. A nurse is providing education to a client prescribed digoxin. Which instructions should the nurse include? Select all that apply. A. Take your pulse for a full minute before taking the medication. B. Hold the medication if your pulse is below 80 beats per minute. C. Report any yellow or green halos around lights. D. Increase your intake of high-fiber foods to prevent constipation. E. Expect some muscle weakness and fatigue, as these are normal side effects. F. Avoid antacids within 2 hours of taking digoxin. Answer. Take your pulse for a full minute before taking the medication. Report any yellow or green halos around lights. Avoid antacids within 2 hours of taking digoxin. This question assesses essential client education for digoxin, a cardiac glycoside. The keyword digoxin cues the nurse to potential cardiac and toxicity concerns. The client must take their apical pulse for a full minute before administration and hold the dose if it's below 60 beats per minute, not 80, as digoxin can slow the heart rate. Reporting visual disturbances like yellow or green halos is crucial as it's a sign of digoxin toxicity. Avoiding antacids within 2 hours is important because they can interfere with digoxin absorption. Muscle weakness and fatigue can be signs of toxicity, not normal side effects. While a high-fiber diet is generally good, it's not a specific instruction directly related to digoxin's primary effects or side effects in the same way as cardiac monitoring or toxicity symptoms. For example, teaching a client to use a stethoscope or palpate their radial pulse reinforces self-monitoring. Here's an easy way to remember it. Think HALOS, hold if slow pulse, 60, avoid antacids, look for halos, toxicity, observe for other toxicity signs. Question 24. A nurse is caring for a client with acute respiratory distress syndrome, ARDS. Which interventions should the nurse anticipate? Select all that apply. A. Administering high-flow oxygen via nasal cannula. B. Positioning the client in a prone position. C. Preparing for mechanical ventilation. D. Administering diuretics to reduce pulmonary edema. E. Monitoring arterial blood gases, ABGs, frequently. F. Restricting fluid intake. Answer. Positioning the client in a prone position, preparing for mechanical ventilation, monitoring arterial blood gases, ABGs, frequently, restricting fluid intake. This question addresses critical nursing interventions for a client with acute respiratory distress syndrome, ARDS. The diagnosis ARDS implies severe lung injury and hypoxemia. Prone positioning can improve oxygenation by redistributing ventilation and perfusion. Mechanical ventilation is often necessary due to severe respiratory failure, and frequent ABG monitoring assesses gas exchange and acid-base balance. Restricting fluid intake helps manage pulmonary edema. Although diuretics may be used judiciously, fluid restriction is a more general supportive measure. High-flow oxygen alone is often insufficient for ARDS, and mechanical ventilation is a primary treatment. For example, carefully monitoring ventilator settings and alarms is essential for client safety. Here's an easy way to remember it. Think ventilate, monitor, position, fluid manage. These are key to improving gas exchange and lung function. Question 25. A nurse is providing discharge teaching for a client with chronic obstructive pulmonary disease, COD. Which instructions should the nurse include? Select all that apply. A. Perform pursed lip breathing during periods of dyspnea. B. Avoid annual influenza and pneumococcal vaccinations. C. Engage in regular, moderate exercise as tolerated. D. Report any increase in sputum production or change in color. E. Use bronchodilators as prescribed, even if you feel well. F. Consume large, heavy meals to maintain energy. Answer. Perform pursed lip breathing during periods of dyspnea, engage in regular, moderate exercise as tolerated, report any increase in sputum production or change in color, use bronchodilators as prescribed, even if you feel well. This question assesses essential discharge teaching for a client with chronic obstructive pulmonary disease, COD. The diagnosis COPD implies the need for strategies to manage respiratory symptoms and prevent exacerbations. Pursed lip breathing helps prolong exhalation and prevent air trapping. Regular moderate exercise improves lung function and endurance, and reporting changes in sputum is crucial for early detection of infection. Using bronchodilators as prescribed helps maintain airway patency and prevents symptom exacerbations. Annual vaccinations are highly recommended to prevent respiratory infections, and small, frequent meals are generally preferred to avoid abdominal distension that can hinder breathing. For example, encouraging the client to walk for 15 minutes a day at a comfortable pace improves lung capacity. Here's an easy way to remember it. Think breathe, breathing techniques, report changes, exercise, avoid irritants, timely medications, health maintenance, vaccines. Question 26. A nurse is preparing to administer an intravenous, push medication. Which actions should the nurse perform? Select all that apply. A. Administer the medication as quickly as possible to ensure rapid effect. B. Check for blood return and patency of the site. C. Dilute all 4 push medications with 10 milliliters of normal saline. D. Cleanse the injection port with an antiseptic swab. E. Flush the line with normal saline before and after medication administration. F. Administer the medication directly into a continuous infusion line. Answer. Check for blood return and patency of the site, cleanse the injection port with an antiseptic swab, flush the line with normal saline before and after medication administration. This question assesses safe practices for administering intravenous push medications. The phrase push medication indicates the need for careful administration to prevent complications. Checking for blood return and patency ensures the is in the vein and functional, cleansing the injection port prevents infection, and flushing the line before and after ensures the medication reaches the client and clears the line. Administering too quickly can cause adverse reactions. Not all medications require dilution or are compatible with normal saline, and administering directly into a continuous infusion line without verifying compatibility or pausing the infusion can lead to medication errors or interactions. For example, pausing a continuous infusion of incompatible fluid before pushing a medication is a critical safety step. Here's an easy way to remember it. Think patency, aseptic, compatible, evaluate, for effects/adverse reactions. Question 27. A nurse is caring for a client experiencing an acute asthma exacerbation. Which findings should the nurse expect? Select all that apply. A. Bradypnea. B. Wheezing. C. Prolonged expiratory phase. D. Distant breath sounds. E. Hyperresonance on percussion. F. Cyanosis. Answer. Wheezing, prolonged expiratory phase, distant breath sounds, hyperresonance on percussion, cyanosis. This question tests the nurse's ability to recognize the clinical manifestations of an acute asthma exacerbation. The phrase acute asthma exacerbation indicates severe airway narrowing. Wheezing is a classic sign of airflow obstruction. A prolonged expiratory phase occurs as air becomes trapped, and distant breath sounds indicate severely diminished airflow. Hyperresonance on percussion suggests air trapping, and cyanosis is a late sign of severe hypoxemia. Tachypnea, not bradypnea, is typically seen as the client tries to compensate for oxygen deficits. For example, a client struggling to speak in full sentences due to shortness of breath shows significant respiratory distress. Here's an easy way to remember it. Think T-I-G-H-T, tight chest, inspiratory and expiratory wheezing, gasping, hypoxemia, tachypnea. Question 28. A nurse is providing education to a client prescribed a new opioid analgesic. Which instructions should the nurse include? Select all that apply. A. Take the medication with food or milk to reduce stomach upset. B. Increase your fluid and fiber intake to prevent constipation. C. You may experience drowsiness, so avoid driving until you know how you react. D. Discontinue the medication immediately if you feel dizzy or lightheaded. E. Report any difficulty breathing or unusual sedation to your healthcare provider. F. It is safe to drink alcohol in moderation while taking this medication. Answer. Take the medication with food or milk to reduce stomach upset. Increase your fluid and fiber intake to prevent constipation. You may experience drowsiness, so avoid driving until you know how you react. Report any difficulty breathing or unusual sedation to your healthcare provider. This question assesses essential client education for opioid analgesics. The keyword opioid analgesic highlights common side effects and safety concerns. Taking with food or milk can help reduce gastrointestinal upset. Increasing fluid and fiber intake is crucial to prevent constipation, and drowsiness is a common side effect requiring caution with activities like driving. Reporting difficulty breathing or unusual sedation is vital as these are signs of respiratory depression, a serious opioid adverse effect. Abrupt discontinuation can lead to withdrawal symptoms, and alcohol should be strictly avoided due to increased central nervous system depression. For example, reminding a client to have a stool softener readily available can help manage constipation proactively. Here's an easy way to remember it. Think SAFE. Opioid, safety, drowsiness/driving, adverse effects, respiratory depression, sedation, food/fluid, GI upset, constipation, education on dosage. Question 29. A nurse is caring for a client who is exhibiting signs of hypoglycemia. Which interventions should the nurse prioritize? Select all that apply. A. Administer 1 ampoule of D50W4 push if the client is unconscious. B. Give the client 4 ounces of orange juice if conscious and able to swallow. C. Recheck blood glucose levels in 15 minutes. D. Administer a complex carbohydrate after blood glucose stabilizes. E. Prepare to administer insulin to lower blood glucose. F. Encourage the client to lie down and rest. Answer. Administer 1 ampoule of D50W4 push if the client is unconscious. Give the client 4 ounces of orange juice if conscious and able to swallow. Recheck blood glucose levels in 15 minutes. Administer a complex carbohydrate after blood glucose stabilizes. This question tests the nurse's immediate response to hypoglycemia. The keyword hypoglycemia indicates low blood sugar requiring rapid intervention. For an unconscious client, for D50W, dextrose 50% is the fastest way to raise blood glucose. For a conscious client, a fast-acting carbohydrate like orange juice is appropriate. Rechecking blood glucose in 15 minutes assesses the effectiveness of the intervention. Once blood glucose stabilizes, administering a complex carbohydrate, e.g., crackers with peanut butter, helps prevent recurrence. Administering insulin would worsen hypoglycemia, and while rest is good, it's not the priority intervention for actively raising blood glucose. For example, ensuring the client has a quick-acting sugar source at their bedside is good anticipatory care. Here's an easy way to remember it. Think 15 to 15 rule. Give 15 g carbs, wait 15 minutes, recheck, repeat if needed, then complex carb. Question 30. A nurse is assessing a client with a suspected urinary tract infection, UTI. Which symptoms should the nurse expect? Select all that apply. A. Polyuria. B. Dysuria. C. Hematuria. D. Flank pain. E. Fever. F. Urgency. Answer: dysuria, hematuria, flank pain, fever, urgency. This question assesses the nurse's ability to identify common signs and symptoms of a urinary tract infection. The keyword urinary tract infection, UTI, guides the nurse to look for inflammatory and infectious indicators. Dysuria, painful urination, hematuria, blood in urine, urgency, sudden strong need to urinate, and flank pain, if the infection has ascended to the kidneys, are characteristic. Fever is also common, indicating a systemic response to infection. Polyuria, excessive urination, is not a typical symptom of a UTI. Frequency is more common, where small amounts are voided often. For example, an elderly client might only present with confusion and generalized weakness, making UTIs in this population challenging to diagnose. Here's an easy way to remember it. Think DYSURIA, dysuria, urgency, smell, foul, fever, incomplete emptying, abdominal/flank pain. Question 31. A nurse is preparing a client for a lumbar puncture. Which actions should the nurse take? Select all that apply. A. Position the client in a prone position. B. Explain the procedure to the client. C. Ensure the client has an empty bladder. D. Monitor vital signs before, during, and after the procedure. E. Administer a sedative as prescribed. F. Obtain informed consent from the client. Answer: explain the procedure to the client, ensure the client has an empty bladder, monitor vital signs before, during, and after the procedure, administer a sedative as prescribed, obtain informed consent from the client. This question tests the nurse's role in preparing a client for a lumbar puncture. The phrase lumbar puncture highlights the need for specific pre-procedure and safety measures. Explaining the procedure, ensuring an empty bladder, monitoring vital signs, administering sedatives as ordered, and obtaining informed consent are all critical preparatory steps to ensure client understanding, comfort, and safety. The client is typically positioned in a side-lying fetal position or seated, bent over a table, not prone, to maximize the space between the vertebrae for needle insertion. For example, demonstrating the fetal position before the procedure helps the client understand what will be expected of them. Here's an easy way to remember it. Think PLACE. PT, position, listen, explain, assess, vitals, consent, empty bladder, pre-medicate. Question 32. A nurse is providing care for a client receiving continuous bladder irrigation after a transurethral resection of the prostate, TURP. Which findings should the nurse report to the healthcare provider? Select all that apply. A. Pink-tinged urine drainage. B. Complaints of bladder spasms. C. Bright red urine with clots. D. Output significantly less than irrigation inflow. E. Client states pain is 3/10. F. Clear, light yellow drainage. Answer: bright red urine with clots, output significantly less than irrigation inflow, complaints of bladder spasms. This question assesses the nurse's ability to identify complications during continuous bladder irrigation post-TURP. The keywords continuous bladder irrigation and TURP indicate a risk for bleeding and obstruction. Bright red urine with clots suggests active arterial bleeding, and output significantly less than irrigation inflow indicates a potential obstruction, e.g., from clots, which can lead to bladder distension and rupture. Complaints of bladder spasms are common but can indicate clot formation or overdistension and warrant assessment and intervention, potentially requiring antispasmodics. Pink-tinged urine is expected, and clear, light yellow drainage is ideal. Client reported pain of 3/10 is usually manageable and within expected postoperative discomfort. For example, if the drainage stops and the client expresses severe bladder pain, the nurse should immediately suspect an obstruction and take action. Here's an easy way to remember it. Think B-L-O-O-D, bleeding, bright red, low output, obstruction, overdistension, spasms, other, pain/infection, document. Question 33. A nurse is caring for a client with a new peripherally inserted central catheter, PIC, line. Which actions should the nurse include in the plan of care? Select all that apply. A. Measure the client's arm circumference daily. B. Use scissors to remove the PICC line dressing. C. Flush the PICC line with heparin daily when not in use. D. Change the dressing using sterile technique. E. Avoid taking blood pressure measurements on the arm with the PICC. F. Administer medications only through the distal port. Answer. Measure the client's arm circumference daily. Change the dressing using sterile technique. Avoid taking blood pressure measurements on the arm with the PICC. This question tests the nurse's knowledge of essential care for a client with a PICC line. The keyword PICC line indicates a central line requiring specific maintenance and complication monitoring. Measuring arm circumference daily can detect phlebitis or thrombosis. Changing the dressing using sterile technique is crucial to prevent infection, and avoiding blood pressure measurements on the affected arm prevents compression and damage to the catheter or vein. Scissors should not be used near a PICC line to prevent accidental cutting. While flushing is necessary, the specific frequency and solution, e.g., saline, then heparin, depend on facility policy and catheter type. Not all PICCs require daily heparin, and saline flush is always included. Medications can be administered through any port after assessing compatibility. For example, teaching the client to protect the PICC line from pulling and contamination is also essential. Here's an easy way to remember it. Think P-I-C-C. Safe, prevent infection, sterile dressing, inspect for complications, arm circumference, care with use, BP avoidance, collaborate, flush based on policy. Question 34. A nurse is preparing to administer an intramuscular, IM, injection. Which actions should the nurse take? Select all that apply. A. Use a 25-gauge needle for an adult client. B. Select an appropriate site based on medication volume and client muscle mass. C. Pull back on the plunger, aspirate, to check for blood return. D. Insert the needle at a 45-degree angle. E. Administer the medication slowly. F. Apply gentle pressure to the injection site after removing the needle. Answer. Select an appropriate site based on medication volume and client muscle mass. Administer the medication slowly. Apply gentle pressure to the injection site after removing the needle. This question assesses correct technique for intramuscular, IM, injection administration. The keyword intramuscular, IM, injection implies specific steps for safe and effective delivery into muscle tissue. Selecting an appropriate site is crucial to avoid nerves, blood vessels, and bone, and to accommodate the medication volume. Administering slowly allows muscle tissue to absorb the medication and reduces pain. Applying gentle pressure helps distribute the medication and prevent leakage. A 25-gauge needle is typically too small for IM injections. A 21 to 23 gauge is often used. Aspiration is no longer recommended by current guidelines for most vaccinations and many IM injections due to lack of evidence for increased safety and potential for increased pain. The needle should be inserted at a 90-degree angle for IM injections, not 45 degrees. For example, using the vastus lateralis for a viscous medication in an adult ensures adequate muscle mass. Here's an easy way to remember it. Think SAFE. IM, site selection, angle, 90 degrees, fluid volume considerations, ensure slow push, gentle pressure. Question 35. A nurse is assessing a client for signs of hypovolemic shock. Which findings should the nurse expect? Select all that apply. A. Bounding peripheral pulses. B. Tachycardia. C. Hypotension. D. Warm, flushed skin. E. Oliguria. F. Increased capillary refill time. Answer: tachycardia, hypotension, oliguria, increased capillary refill time. This question tests the nurse's ability to identify clinical manifestations of hypovolemic shock. The phrase hypovolemic shock indicates a critical lack of circulating blood volume. Tachycardia occurs as the heart compensates for decreased volume, hypotension results from insufficient blood pressure, and oliguria, decreased urine output, reflects reduced renal perfusion. Increased capillary refill time indicates poor tissue perfusion. Bounding pulses and warm, flushed skin are typically associated with hypervolemia or distributive shock, e.g., septic shock, not hypovolemic shock where pulses are weak and skin is cool/clammy. For example, a client who is actively bleeding and presents with a rapid heart rate, low blood pressure, and cold extremities is likely in hypovolemic shock. Here's an easy way to remember it. Think L-O-W V-O-L-U-M-E, low BP, oliguria, weak pulse, cool skin, increased HR, mental status changes, empty veins. Question 36. A nurse is providing education to a client prescribed a new anticoagulant medication. Which foods should the nurse instruct the client to limit or avoid? Select all that apply. A. Spinach. B. Kale. C. Oranges. D. Broccoli. E. Apples. F. Green tea. Answer: spinach, kale, broccoli, green tea. This question assesses knowledge of dietary restrictions for clients on anticoagulant medications, particularly warfarin. While not explicitly stated, anticoagulant implies potential interaction with vitamin K. Spinach, kale, and broccoli are all high in vitamin K, which can counteract the effects of warfarin. Green tea also contains vitamin K and can interfere with anticoagulation. Oranges and apples do not significantly impact vitamin K levels. For example, teaching a client to maintain a consistent intake of vitamin K-containing foods rather than avoiding them entirely, if they are already eating them, helps prevent large fluctuations in INR. Here's an easy way to remember it. Think green is mean. Green leafy vegetables are often high in vitamin K. Question 37. A nurse is assessing a client with a suspected urinary tract infection, UTI. Which symptoms should the nurse expect? Select all that apply. A. Polyuria. B. Dysuria. C. Hematuria. D. Flank pain. E. Fever. F. Urgency. Answer: dysuria, hematuria, flank pain, fever, urgency. This question assesses the nurse's ability to identify common signs and symptoms of a urinary tract infection. The keyword urinary tract infection, UTI, guides the nurse to look for inflammatory and infectious indicators. Dysuria, painful urination, hematuria, blood in urine, urgency, sudden strong need to urinate, and flank pain, if the infection has ascended to the kidneys, are characteristic. Fever is also common, indicating a systemic response to infection. Polyuria, excessive urination, is not a typical symptom of a UTI. Frequency is more common, where small amounts are voided often. For example, an elderly client might only present with confusion and generalized weakness, making UTIs in this population challenging to diagnose. Here's an easy way to remember it. Think dysuria, dysuria, urgency, smell, foul, fever, incomplete emptying, abdominal/flank pain. Question 38. A nurse is providing education to a client about proper use of crutches. Which instructions should the nurse include? Select all that apply. A. Place the crutch tips 6 inches in front and 6 inches to the side of your feet. B. Bear weight primarily on your armpits. C. Ensure there are 2 to 3 finger widths between the crutch pad and your axilla. D. When going upstairs, lead with the crutches first, then the affected leg. E. Keep your elbows slightly bent when holding the crutches. F. Use a 3-point gait when partial weight bearing is allowed. Answer. Place the crutch tips 6 inches in front and 6 inches to the side of your feet. Ensure there are 2 to 3 finger widths between the crutch pad and your axilla. Keep your elbows slightly bent when holding the crutches. This question tests the nurse's knowledge of proper crutch use. The phrase proper use of crutches emphasizes safety and correct body mechanics. Placing crutch tips 6 inches in front and 6 inches to the side provides a stable base of support. Ensuring 2 to 3 finger widths between the crutch pad and axilla is crucial to prevent nerve damage and pressure on the axillary blood vessels, as weight should not be borne on the armpits. Keeping elbows slightly bent allows for effective use of arm strength. When going upstairs, the unaffected leg should lead first, followed by the crutches and affected leg. A 3-point gait is used for non-weight bearing or partial weight bearing. However, the description for going upstairs was incorrect. For example, teaching a client to look forward, not down at their feet, improves balance. Here's an easy way to remember it. Think fit and forward, fit correctly, no axillary pressure, bent elbows, and move forward safely, unaffected leg up first. Question 39. A nurse is caring for a client with a history of recurrent urinary tract infections, UTIs. Which teaching points should the nurse reinforce to prevent future episodes? Select all that apply. A. Increase intake of carbonated beverages. B. Void every 2 to 3 hours, even if not feeling the urge. C. Take prophylactic antibiotics for 6 months as prescribed. D. Wear tight-fitting synthetic underwear. E. Avoid douching or feminine hygiene sprays. F. Drink cranberry juice regularly. Answer. Void every 2 to 3 hours, even if not feeling the urge. Avoid douching or feminine hygiene sprays. Drink cranberry juice regularly. This question addresses health promotion for preventing recurrent UTIs. The phrase recurrent urinary tract infections, UTIs, highlights the need for proactive preventative strategies. Voiding frequently helps flush bacteria from the bladder. Avoiding douching and feminine hygiene sprays helps prevent irritation and disruption of normal flora, and drinking cranberry juice may help prevent bacteria from adhering to the bladder wall. Increasing carbonated beverage intake is not recommended, and wearing tight-fitting synthetic underwear can promote moisture and bacterial growth. While prophylactic antibiotics may be prescribed, it's a medical intervention rather than a general teaching point for all clients. For example, advising a client to hydrate adequately throughout the day ensures consistent bladder flushing. Here's an easy way to remember it. Think FLUSH, frequent voiding, lots of water, underwear, cotton, stay clean, wipe front to back, hygiene, no irritants. Question 40. A nurse is assessing a client who just received epidural anesthesia. Which adverse effects should the nurse monitor for? Select all that apply. A. Hypertension. B. Pruritus. C. Nausea and vomiting. D. Respiratory depression. E. Urinary retention. F. Headache. Answer. Pruritus, nausea and vomiting, respiratory depression, urinary retention, headache. This question tests the nurse's understanding of potential adverse effects following epidural anesthesia. The keyword epidural anesthesia indicates the need to monitor for both common and serious complications. Pruritus, itching, nausea and vomiting, respiratory depression, urinary retention, and headache, especially a post-dural puncture headache, are all recognized side effects or complications of epidural anesthesia. Hypotension, not hypertension, is a common adverse effect due to vasodilation. For example, closely observing the client's respiratory rate and depth is crucial for early detection of respiratory depression. Here's an easy way to remember it. Think H-Y-D-R-A-N-T, hypotension, though hypertension isn't typical, itching, dyspnea, respiratory depression, retention, urinary, anxiety, nausea/vomiting, tremors/tingling, headache. Question 41. A nurse is caring for a client with a chest tube following a pneumothorax. Which findings require immediate intervention? Select all that apply. A. Constant bubbling in the water seal chamber. B. Tidling in the water seal chamber. C. Drainage of 75 milliliters from the chest tube in the last hour. D. Disconnection of the chest tube from the drainage system. E. Subcutaneous emphysema around the insertion site. F. Chest tube accidentally pulled out of the client's chest. Answer. Constant bubbling in the water seal chamber, drainage of 75 milliliters from the chest tube in the last hour, disconnection of the chest tube from the drainage system, subcutaneous emphysema around the insertion site, chest tube accidentally pulled out of the client's chest. This question assesses critical assessment skills for a client with a chest tube. The phrase chest tube following a pneumothorax directs attention to potential emergencies. Constant bubbling in the water seal chamber indicates an air leak, which needs investigation. Drainage of 75 milliliters per hour is excessive and suggests hemorrhage, requiring immediate notification. Disconnection of the chest tube from the drainage system creates an open system, increasing the risk of pneumothorax. Subcutaneous emphysema suggests air leakage into the tissues. An accidental dislodgement of the chest tube requires immediate intervention to cover the site. Tidling, fluctuations, in the water seal chamber is a normal and expected finding. For example, if the chest tube falls out, covering the insertion site immediately with a sterile dressing taped on 3 sides allows air to escape but not re-enter. Here's an easy way to remember it. Think leak, bleed, out, air leak, bleeding, excessive drainage, tube out/disconnected. Question 42. A nurse is preparing to administer medications to a client. Which of the rights of medication administration should the nurse verify? Select all that apply. A. Right client. B. Right medication. C. Right dose. D. Right route. E. Right time. F. Right documentation. Answer. Right client, right medication, right dose, right route, right time, right documentation. This question tests the nurse's adherence to the fundamental principles of safe medication administration. The concept is often referred to as the rights of medication administration. Verifying the right client, right medication, right dose, right route, right time, and right documentation are all crucial steps to ensure safe and accurate medication delivery and to prevent errors. These 6 rights form the bedrock of medication safety. For example, checking the client's armband and asking them to state their name and date of birth confirms the right client. Here's an easy way to remember it. Just recall the 6 rights: client, drug, dose, route, time, documentation. Question 43. A nurse is providing discharge teaching to a client with a new prescription for iron supplements. Which instructions should the nurse include? Select all that apply. A. Take the iron supplement with milk to prevent stomach upset. B. Expect your stools to become dark or black. C. Increase your intake of citrus fruits to enhance absorption. D. Report any constipation or diarrhea. E. Take the medication at bedtime to improve absorption. F. Avoid taking iron with antacids. Answer. Expect your stools to become dark or black. Increase your intake of citrus fruits to enhance absorption. Report any constipation or diarrhea. Avoid taking iron with antacids. This question assesses key client education for iron supplements. The keyword iron supplements indicates specific absorption and side effect considerations. Dark or black stools are a common and harmless side effect of iron. Increasing intake of vitamin C-rich foods, like citrus fruits, enhances iron absorption. Constipation and diarrhea are common gastrointestinal side effects that should be reported so they can be managed. Antacids can decrease iron absorption and should be avoided for several hours before and after iron. Iron should be taken on an empty stomach for best absorption, not with milk, which can hinder absorption, and can be taken at bedtime if stomach upset occurs, but not specifically to improve absorption. For example, teaching a client to drink iron with orange juice reinforces better absorption. Here's an easy way to remember it. Think iron strong. Enhance absorption with vitamin C, stools darken, avoid antacids, watch for GI upset. Question 44. A nurse is caring for a client who underwent a unilateral mastectomy. Which actions should the nurse include in the plan of care to prevent lymphedema? Select all that apply. A. Encourage range of motion exercises for the affected arm. B. Avoid blood pressure measurements on the affected arm. C. Elevate the affected arm on a pillow. D. Apply warm compresses to the affected arm daily. E. Administer diuretics as prescribed to reduce swelling. F. Instruct the client to wear compression garments on the affected arm. Answer. Encourage range of motion exercises for the affected arm. Avoid blood pressure measurements on the affected arm. Elevate the affected arm on a pillow. Instruct the client to wear compression garments on the affected arm. This question assesses preventive measures for lymphedema after a mastectomy. The phrase unilateral mastectomy and prevent lymphedema are key. Encouraging range of motion exercises promotes lymphatic drainage. Avoiding blood pressure measurements on the affected arm prevents constriction and fluid accumulation, and elevating the arm helps reduce swelling through gravity. Instructing the client to wear compression garments provides external support to prevent fluid accumulation. Warm compresses can increase swelling in some cases, and diuretics are generally not effective for lymphedema, which is a protein-rich fluid buildup, not simply fluid retention. For example, teaching the client to protect the affected arm from cuts or insect bites helps prevent infection and further lymphatic compromise. Here's an easy way to remember it. Think PROTECT, prevent injury/infection, restrict tight clothing, observe for swelling, teach exercises, elevate, compression therapy, take BP on unaffected side. Question 45. A nurse is caring for a client with a severe headache, photophobia, and nuchal rigidity. Which actions should the nurse prioritize? Select all that apply. A. Administer analgesics as ordered. B. Place the client in a private room. C. Prepare for a lumbar puncture. D. Maintain strict droplet precautions. E. Dim the lights in the client's room. F. Provide a warm compress to the neck. Answer. Administer analgesics as ordered, place the client in a private room, prepare for a lumbar puncture, maintain strict droplet precautions, dim the lights in the client's room. This question tests the nurse's ability to prioritize care for a client presenting with symptoms suggestive of meningitis. The keywords severe headache, photophobia, and nuchal rigidity are classic signs of meningeal irritation. Administering analgesics and dimming the lights help manage the severe pain and light sensitivity. Placing the client in a private room and initiating droplet precautions are critical to prevent the spread of potential infectious meningitis. Preparing for a lumbar puncture is necessary for diagnostic confirmation. A warm compress might not alleviate nuchal rigidity and isn't a priority over infection control and diagnosis. For example, minimizing environmental stimuli helps the client cope with headache and photophobia. Here's an easy way to remember it. Think meningitis protocol, pain management, isolation, diagnostics, environmental control. Question 46. A nurse is teaching a group of clients about healthy lifestyle choices to prevent cardiovascular disease. Which statements should the nurse include? Select all that apply. A. Aim for at least 150 minutes of moderate intensity aerobic activity per week. B. Limit saturated and trans fats in your diet. C. Smoking cessation is not necessary if you exercise regularly. D. Maintain a healthy body weight. E. Manage stress through relaxation techniques. F. Increase your sodium intake to maintain electrolyte balance. Answer. Aim for at least 150 minutes of moderate intensity aerobic activity per week. Limit saturated and trans fats in your diet, maintain a healthy body weight, manage stress through relaxation techniques. This question assesses knowledge of health promotion for cardiovascular disease prevention. The phrase healthy lifestyle choices to prevent cardiovascular disease focuses on modifiable risk factors. Engaging in at least 150 minutes of moderate aerobic activity weekly is a key recommendation. Limiting saturated and trans fats helps reduce cholesterol levels, maintaining a healthy body weight reduces strain on the heart, and managing stress can lower blood pressure and improve overall heart health. Smoking cessation is absolutely necessary and is one of the most impactful changes, regardless of exercise. Sodium intake should generally be limited, not increased, to prevent hypertension. For example, advising clients to choose lean proteins and whole grains instead of processed foods promotes heart-healthy eating. Here's an easy way to remember it. Think HEART, healthy weight, exercise, avoid bad fats/smoking, reduce stress, take care of yourself. Question 47. A nurse is caring for a client with an acute exacerbation of ulcerative colitis. Which findings should the nurse expect? Select all that apply. A. Constipation. B. Bloody diarrhea. C. Abdominal cramping. D. Weight gain. E. Fever. F. Anemia. Answer. Bloody diarrhea, abdominal cramping, fever, anemia. This question tests the nurse's ability to identify the clinical manifestations of ulcerative colitis exacerbation. The phrase acute exacerbation of ulcerative colitis indicates severe inflammation of the colon lining. Bloody diarrhea, often frequent and urgent, is a hallmark symptom. Abdominal cramping is common due to intestinal inflammation, and fever can indicate an inflammatory response. Anemia often develops due to chronic blood loss through the stool. Constipation is more common in Crohn's disease or irritable bowel syndrome, and weight loss, not gain, is typical due to malabsorption and chronic inflammation. For example, a client may describe numerous liquid stools each day mixed with blood and mucus. Here's an easy way to remember it. Think U, C. F, L, A, R, E, urgent bowel movements, cramping, fever, liquid stool with blood, anemia, rectal bleeding, electrolyte imbalance. Question 48. A nurse is providing education to a client with a new prescription for a proton pump inhibitor, PPI. Which instructions should the nurse include? Select all that apply. A. Take this medication after meals to reduce stomach upset. B. It may take several days for the full effects of the medication to be felt. C. This medication can be crushed and mixed with applesauce if you have difficulty swallowing. D. Report any new onset of diarrhea to your healthcare provider. E. Continue taking the medication even if your symptoms improve. F. You can stop taking this medication suddenly if you feel better. Answer. It may take several days for the full effects of the medication to be felt. Report any new onset of diarrhea to your healthcare provider. Continue taking the medication even if your symptoms improve. This question assesses essential client education for proton pump inhibitors, PPIs. The keyword proton pump inhibitor, PPI, indicates a medication that reduces stomach acid. It can take several days for the full effect to be felt, as the PPIs work by inhibiting proton pumps. New onset of diarrhea, especially persistent or severe, should be reported as it can be a sign of C. difficile infection. Clients should continue taking the medication as prescribed, even if symptoms improve, to ensure complete healing, and sudden discontinuation can lead to rebound acid hypersecretion. PPIs are generally taken before meals, not after, and crushing depends on the specific formulation. Many are enteric-coated and should not be crushed. For example, taking the medication 30 to 60 minutes before breakfast is often recommended for maximum efficacy. Here's an easy way to remember it. Think PPI. PROTECTS, pre-meal, report diarrhea, ongoing use, take as directed, expect delay in full effect, diff risk, taper slowly. Question 49. A nurse is assisting with the admission of an older adult client to a long-term care facility. Which assessments are particularly important for this population? Select all that apply. A. Nutritional status. B. Functional ability. C. Cognitive status. D. Social support system. E. History of childhood diseases. F. Medication reconciliation. Answer. Nutritional status, functional ability, cognitive status, social support system, medication reconciliation. This question focuses on comprehensive assessment needs for older adults in long-term care. The phrase older adult client to a long-term care facility highlights specific vulnerabilities and needs of this demographic. Nutritional status is crucial due to potential malnourishment. Functional ability assesses their independence in activities of daily living, and cognitive status screens for dementia or delirium. Evaluating the social support system helps identify resources and potential isolation, and medication reconciliation is vital to prevent polypharmacy and adverse drug events. While a history of childhood diseases is part of a complete history, it's less immediately critical for admission and ongoing care in this specific setting compared to the other factors. For example, assessing for recent unintentional weight loss is an important part of a nutritional assessment. Here's an easy way to remember it. Think FRAILS, falls, readiness for discharge, ADLs, incontinence, lifestyle, social support, or more simply, a holistic view for the older adult. Question 50. A nurse is caring for a client receiving continuous renal replacement therapy, CRRT. Which actions should the nurse include in the plan of care? Select all that apply. A. Administer intravenous fluids as prescribed to prevent dehydration. B. Monitor blood pressure frequently. C. Assess the client for signs of electrolyte imbalances. D. Change the CRRT filter every 8 hours regardless of clots. E. Monitor the client's weight daily. F. Administer anticoagulants as prescribed to maintain circuit patency. Answer. Monitor blood pressure frequently, assess the client for signs of electrolyte imbalances, monitor the client's weight daily, administer anticoagulants as prescribed to maintain circuit patency. This question assesses essential nursing care for a client undergoing continuous renal replacement therapy, CRRT. The keyword CRRT indicates a continuous, slow form of dialysis with specific management needs. Monitoring blood pressure frequently is critical due to potential fluid shifts and hypotension, and assessing for electrolyte imbalances is vital because CRRT constantly removes fluid and solutes, requiring careful replacement. Daily weight monitoring helps assess fluid balance, and administering anticoagulants, e.g., heparin or citrate, is often necessary to prevent clotting in the CRRT circuit. CRRT aims to remove excess fluid, so administering additional fluids may counteract the treatment goals unless specifically ordered for replacement. Filter changes are done as needed based on clotting or operational issues, not a fixed 8-hour schedule. For example, observing for muscle weakness or cardiac arrhythmias could indicate potassium imbalances. Here's an easy way to remember it. Think CRRT. CARE, continuous monitoring, BP, electrolytes, replacement fluids, carefully, remove waste, troubleshoot circuit, evaluate weight.